So what's the best way to lose weight? Would it be little tiny changes over and just kind of maintain them over time, or are big changes, attempts to make big losses in your weight, are those the better ways to treat the disease of obesity? Lots of people have opinions on that. I'm sure you think you have your answer right there, but let's go ahead and nerd out for a little bit. We're going to go through something called the SNAP trial, where they specifically looked at that question. What is the best way to lose and maintain weight loss? Is it doing small kind of baby step changes, or is it kind of starting for a big loss and then just trying to hold on? So let's go through that. This study recruited 600 people. These people were all age range between 18 and 30. Their BMI, and I understand that there are some reluctances to some people to go use BMIs. It's not a perfect system, but the BMIs rated for them was between 21 and 30. So the thing to note there, between 21 and 30 has a decent amount of range for what that BMI means. The general CDC guidelines for that is that a BMI between 18 and 25 would be considered a normal and healthy weight. The issue is half of the people starting this test were in that healthy weight range, right? Their BMI was between 21 and 25. And then the other group of the people were in the range that is called overweight, not considered suffering from medical obesity, but their weight was at a range that was classified as overweight. That's 25 to 30. So this study had people who were both classified as having a normal weight and people who were classified as being over the ideal weight and being in the category of overweight. So that is the people that you're dealing with. And what they did was they broke these people into three groups. One group was just told, hey, try and watch your weight. And that was pretty much it. The second group, this is the baby steps group, they were told to change their intake, their calorie intake by 100 calories and to increase their physical activity by 100 calories. That's per day. So the issue here is like when you think about trying to break that down, well, what does 100 calories actually mean, right? So a Snickers bar happens to be approximately like the regular size Snickers bar. Happens to be about 215 calories. So what they told these people was, hey, every day you're going to reduce your calorie intake by approximately half a Snickers bar, right? And then they said you're going to increase your physical activity by 100 calories. That's pretty much a fast walk for 20 minutes for most people, right? That's kind of the ballpark figures here. Now, when you think about it, those are relatively minor changes, which is why this qualifies as the baby step arm of this study. The large study group was told that they needed to reduce their calorie intake by 500 to 1,000 calories per day below their established baseline, right? And they were supposed to work up to 4 hours a week, 250 minutes, 4 hours a week of physical activity. And the goal there was that these people would, if they were classified in that healthy weight range, the 18 to 25, that they would lose a little over 2 kilograms, right? And if they were classified as overweight based off their weight scale, so they had a BMI between 25 and 30, that they would then lose a little over 4 kilograms, which is, 8 or 10 pounds, right? So those are the goals. And the theory for those folks is once they lost that weight, they would be then they'd be at their new established baseline for the study, and they could kind of go back to the old plan and just try and hold on. But if they started gaining weight from what their new baseline was for the study, they were supposed to return to the calorie deficit and return to the physical activity. So they followed these folks for 3 years, okay? 3 years. At the beginning, they each had 10 sessions over 4 months to try and get this plan established, and they followed them for 3 years. There was statistical difference in how these people did. And I think that kind of makes sense, right? I think it would totally stand logically that the folks who were just told, hey, watch your weight, that the control arm, right, that they would probably be slightly heavier on average at the end of the trial than the folks who had very specific calorie and physical activity goals. But who do you think lost more weight? Was it the baby step or was it the lose a lot and then try and hold on? I'll let you choose, and then I'm going to tell you the answer. It was actually the big steps. But both groups lost weight statistically significantly more than the control arm. So the control arm at the end of the 3-year study had really only gained, on average, an average of a little over 0.2 kilograms, a quarter of a kilogram, right? Somewhere in the range of half a pound. And for a 3-year period, to gain roughly half a pound between 18 and 35, which is how old these people were, is pretty reasonable maintenance of weight, right? That's not horrible. That's doing pretty good. The baby step group happened to lose a little over half a kilogram. So they lost over a pound on average. Now, obviously, some folks would still gain weight, some folks would lose more, but they managed to do pretty well, and they lost a little over a pound, just over half a kilogram. Now, the group that won, the large change, the big change group, right? They actually lost over 2 kilograms. Almost made it to an average of 5 pounds of weight loss over those 3 years. So when you think back to their original goal, where they were going to lose just over 2 kilograms if they were considered in a normal BMI, right? Or they were going to try and lose 4 kilograms if they were considered to be in an overweight status. Then they, on average, managed to maintain for 3 years an average of just over 2 kilograms worth of weight loss. That is pretty decent. That's almost 5 pounds lighter 3 years down the road than they were. And holding that off was really, really helpful to them. I think another thing that is important to look at is not just averages, right? Because if I'm someone who I'm trying to do something and maybe I'm not performing as well as everybody else is, or I'm not getting the results that are the average, part of me might want to wonder, well, how rare is it for me to be one of the people who has outcomes that I'm a little less than satisfied with? So let's take a look at all of these people who started in the either normal BMI category or in the category of BMI that would be classified as overweight, and how many of them ended up being diagnosed with obesity by the end of the 3-year trial. Now, the rates of people who, in these 3 arms, the control, the baby steps, and the big changes, who were diagnosed as having obesity by the end of the trial, those numbers were pretty significant. Now, the baby steps and the larger changes groups, those were both right around 8% of people in that group ended up being diagnosed as having obesity by the end of the 3. The issue is that those were 8, so those were roughly the same, but twice as often, 16.9%, twice as often in the control group, the group that didn't actually make a whole lot of changes, right? So I think the important takeaway here is that your ability to try and lose weight and maintain weight loss over time, and your ability to try and avoid the likelihood of being diagnosed as suffering from obesity down the road as well, those are both increased by just doing something and trying to keep at something, right? So that's whether you're doing baby step changes, whether you're doing a big change and trying to hold on to that, doing anything, an active plan, baby steps, whatever, is all helpful to you. Now, statistically, this showed that big steps and then trying to hold on to that, giving yourself that buffer zone up at the beginning, that was actually the most helpful, but both still work. So talk to your physician, talk to your healthcare team, and come up with a plan and just do something. Whether you're a baby steps kind of person or you're a big changes kind of person, if you want to help avoid the odds of being diagnosed with obesity in the future, you can do something right now that statistically is useful, baby steps or big changes. They both work. Big changes just happen to work a little bit better.